Hi, this is Karen from Tater Tot Pup, and I am here to give you a little bit of knowledge on teacup puppy ownership and how to care for them. Micros are very different in their care than regular dogs, and they really have a bad rap because people really don't know how to care for a micro tiny. The main thing is when you get them home, they will be stressed and they don't always want to eat at first. So it's up to you to make sure that you get that nutrition in them and that you keep their sugar levels up, because they can go down very fast, and once they go down, it's really hard to bring them back. The first thing that you want to make sure you have is a kennel, a small kennel or crate, and it's important that you pick something that will confine them so their energy levels will not be compromised. I suggest this crate right here. It's a plastic pen and it works very well with micros. I always attach a water bottle on the side, and I end up using bungee cords because the silver attachment, they just don't work. The ones that come with the bottles, they don't work with this cage. So I end up buying small bungee cords from Home Depot and I attach it that way. All of these products are found on my Amazon store that I put together, and I will put the link at the bottom of this email for you to find and click on, and you can purchase the items right from that store. So once I get this crate set up, I'm going to put a bed. I'm going to buy a bed, a fluffy bed, and I'm going to put it in one corner. If you're in a very cold environment, I suggest putting halfway underneath it a heating pad, some sort of heating pad, and make sure that your puppy can't get to the wires and electrocute themselves under half of the bed. And then I always like to have a pad holder to hold the pads in the other corner of the crate, and then I will buy pads, training pads, and put them in there. Now, your puppy should reside most of his life until he's an adult inside this crate. It will keep him free from eating things that he shouldn't be eating, because they're very inquisitive, and little things can really harm these dogs. You may not see them eat it, but they pick things up all the time, and they don't have large systems, large intestines, large tummies, so little things make a big difference on these dogs. So confinement is very important for that reason, and also hypoglycemia. Feeding. Let's talk about feeding. On most of our tinies, I use Royal Canin extra small kibble. Let's see, here's a good picture of it, and that's also found on our store. Now, depending on your tiny, I give them a small handful. Some micros, when they first come home, they can't eat all of this. This would be a lot for them to eat. You can count out about 50 pieces, and sometimes a new puppy can eat that much, sometimes they can't, but you do want to make sure they're consuming enough, because if they're not consuming enough, you're in danger of hypoglycemia. So the first thing when I get up, I will feed them, a handful of this kibble. And then after that, about an hour after they eat, I like to give them a pea-sized amount of nurtical. So this is important to give new puppies and tiny adult dogs as well, if they're expending a lot of energy, if they're out playing more, if they're outside, which I don't suggest, because the hawks always circle and tend to look at these little dogs like they're a rabbit, and so I don't really suggest micro dogs being outside too much. They really don't need the exercise that a toy dog needs. So running around your home in itself, supervised, is enough exercise for an adult micro puppy. An adult micro. A puppy really doesn't need that type of exercise. Inside the crate, they're getting all the exercise that they need because you don't want them to expend too much energy. So the nurtical should be given 3 times a day, depending on exertion amounts. So if your puppy is out playing a little bit more than usual, if you have him out of his crate a little bit more, you'll want to give a pea-sized amount of this before playtime on top of the regular 3 times a day regimen that you will have them on. The next thing I want to talk about is water bottles. Most of my micros come home and they know how to eat or drink from a water bottle. I use this Luxating small water bottle, 16 ounces, and I always make sure that I use purified water, never tap. Tap water contains bacteria at times that can cause loose stool and other intestinal problems in a micro, and I never suggest tap water, always purified. Now, distilled is an option. Sometimes there have been reports of distilled water not having the nutrients in it as much, so then it does somewhat, or can cause a little bit of constipation. So that's important. You just want to stay away from that. So I like purified water. Sometimes when you have the tiniest dogs, I do suggest for very tiny micros a starter formula. This is mini starter. You can get, I believe, an extra small breed mini starter kibble, and I think that when they're very tiny, maybe under a pound, you would want to use this this type of food, maybe for the first couple months anyway. Once they're over about 1.5 pounds, then I like to move over to the extra small Royal Canin puppy kibble. And this kibble is very small, so it's very easy for them to eat. Now, I do moisten it for the extra tinies if they're under 1.5 pounds. A lot of times, and this is a big misconception with micros, veterinarians don't even recognize their age because they don't even get their front teeth until they're 5 months old. So don't fall victim of this. If your vet is saying, oh, well, I question this age, a micro is a whole different ballpark. So don't ever listen to that, because that means nothing when you're dealing with a micro tiny dog. Their teeth come in completely different ages. Every dog is different with a micro. The next thing I want to talk about is food bowls. This is a good food bowl that I recommend, and it's on our Amazon store list, which the link is provided below. And I just think it's important to have a nice, clean, fresh stainless steel or ceramic food bowl, and make sure that it's cleaned out with hot soapy water at least once a week. You can wipe it out every day, but make sure it gets a good washing once a week. The same with the water bottle. You want to make sure, because this can get moldy inside, and it's real important that since it always has water in it, that you buy a bottle scrub brush and you scrub it with hot soapy water. I think I did talk about the training pads, but there they are, and they are on my site. I put them inside the training pad holder. Now, say you get the water bottle and you put the purified water in it. I really suggest the first year of life, if not after, to add a little bit of sugar. This is all natural organic sugar, and I put, for 16 ounces, this is a 16-ounce bottle, I will put 2 teaspoons of this sugar into that water bottle for protection of hypoglycemia. I know there are others that recommend using flavorless Pedialyte as well, and that is an option. I do have picky little micros sometimes that do not like the flavor of that and will just not drink their water then. So I have found that to be a problem. You can try it if your dog will drink from the Pedialyte, then that's a good option. Still, you need to maintain the sugar in that the first year of life. And if I have a baby that does have a loose stool, whatever, and will come across diarrhea, I will use a syringe and I will drip Pedialyte into the side of their mouth very slowly, making sure not to aspirate. And I will do this several times a day until I see my baby drinking enough that he's consuming and peeing on a regular basis. Another thing is if they do get diarrhea, I suggest a product called Pepto-Bismol, and I will give them a 1 cc every 4 hours until I see their stool harden up. Now, I do want to talk about a baby that may not want to eat at all. If they're stressed and they're not wanting to eat, you can first try this product called Gerber. Let's see if I can get it. It's Gerber chicken and chicken gravy. It's on my product list as well on my Amazon store under essential care items. And you can get this. I like the beef and gravy, and I like the chicken and chicken gravy. And sometimes I will just mix it inside their kibble and feed it that way. Now, you never, ever, ever want to give these little babies too much food. Too much food is almost as bad as too little food, because their stomachs are very, very tiny, and if they don't have it in them yet, that instinct to stop eating, they will eat and eat and eat until they get very sick. They start throwing up, they start diarrheaing, and to the point where they go hypoglycemic. So it's very important to monitor how much they're eating and make sure they're only getting the correct amounts. Now, I think I've gone over everything with you so far on all the essential care items. Please make sure that you keep your baby in these playpens for the first year of life. And every time that you take them out, they need to be prepared with nurtical. So if they come out for playtime, even if it's in your lap, you give them a small pea-sized amount of this nurtical. It should be given a minimum of 3 times a day, alternating in between meals. Now, if they certainly refuse even to eat the chicken Gerber and the kibble mixed together, you can just pick this out with a syringe, suck it up with a syringe, and give them about 6 cc's, 5 to 6 cc's of this, being very careful not to aspirate them. The side of their mouth, there's a place where their teeth have sort of, a space between them where you can put that syringe and you can slowly, ever so slowly dispense that cc into their mouth. And make sure they swallow. You can know this because they'll lick their lips. Now, vaccinations are very important in my opinion. You want to make sure that these dogs are not overly vaccinated. Half a vaccine at most. Rabies vaccine, be very, very careful with this. I know there were reports from neurologists, and I have seen reports of this vaccine being very dangerous to these dogs. I've seen reports of it causing heart problems, seizure disorders, head tilting, disorientation, rabies symptoms. It's a terrible, terrible vaccine for these little guys. I know the first year when we sell them, we have to give them, a small amount, as the vets recommend only small amounts. Veterinarians that understand tinies. There are so many veterinarians that just don't deal and see with little micros very much. So they tend to give the wrong advice. And this is not something that we like to deal with very much, because it's always an argument with them. So try to find a vet that really specializes or understands micro tinies before you see them, and make sure that they see at least 100 micros a year to be able to even be versed in them, because they are a different ballpark compared to a regular toy dog. Also, another thing is intravenous sedation. That's a big no-no with these dogs. You don't want to go to a vet that would do this. That could possibly kill them. You know, they take such an aggressive approach. When they want to take blood out of a hypoglycemic puppy just to figure out what's wrong with it, that's a huge red flag. You should never take blood out of a hypoglycemic puppy at that point. That puppy is very weak. That puppy needs stability. It doesn't need testing and liver shunt testing, and they just want to throw that out there far too many times, and it's dangerous and it's negligent. So really, really go out there, do your homework, and find the proper vets. Find other teacup breeders in your area that might have a great suggestion for you on who to go to. There are a couple things that are shed negative light on, that should not be shed negative light on these tinies. One is luxating patellas. About 80% of these micros have them. A lot of times you don't even need surgery because they weigh so there's no weight on their knees. So I would never condone surgery to a luxating patella unless they're older in life and they're immobile. Not just that, you know, you feel the popping on the knee. No, it should not be done, in my opinion, unless immobility and so much pain that they can barely walk. They are in so much pain. And this is a given. This is a given. If you own a micro tiny, you've got an 80% chance that you are going to have to, at one point, deal with luxating patellas. Another issue is tracheal collapse. These tracheas are very small. They're windpipes, and they can collapse very easily. They can, you know, a lot of them, you'll hear the honking noise and the snorting noise. And how I deal with this is I just stroke their throat. I stroke their throat until their honking is over, and usually they live very long lives, even with this condition, if they do have it. And they, you know, it's not something that needs to be stressed by an experienced veterinarian, because a regular dog, you don't see this with them very much. But with a tiny, again, you're going to see a lot of it. You're also going to see sometimes they come with belly button hernias, and that's just where the mother had pulled the umbilical cord away from their tummy, and it creates a little hernia there. And that can be dealt with very easily during the spay and neuter. The doctor can just put a stitch in there. Again, gas sedation when the dog is spayed or neutered. Never, ever intravenous on these little dogs. Well, I want to thank you all for paying attention and listening to me and giving me your time. I hope that you've learned something during this little blog. And if you ever have any questions, feel free to email me, tatertotpup@aol.com. And I do have a Tiny Care page on my website, which I'll give you a link at the bottom of this tutorial. So I want to thank you all, and have a wonderful day, and happy microing.